views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to the new season of Open 2.0. We're the new Open 2.0 crew. Today we want to learn more about the pandemic and how is it currently affecting young people. Joining us is Jocelyn LeBron, the Bronx healthcare advocate of the Healthcare Education Project. She works closely with the Bronx community to advocate for our health rights on state and federal levels. Welcome to the show, Jocelyn. It's great to have you here.
Thank you for having me. I'm so happy to join all of you. This is great work that you all are doing for putting this show together. So I'm really excited.
Welcome again, Jocelyn. My name is Olivia. Can you tell us more about the Healthcare Education Project and the mission of HEP?
Sure. Hi, Olivia. So the Healthcare Education Project is a community-based advocacy organization. We work in partnership with individuals, healthcare providers, civic and religious leaders in neighborhoods across New York to protect access to critical healthcare services for all New Yorkers. And our mission is to protect and expand access to quality, affordable healthcare for all New Yorkers through education, advocacy, and coalition building.
Those are great examples. My name is Hawa, and I just wanted to ask you, what do you think about remote learning in relation to youth health?
So I have two kids, one's 7 and she's in remote learning now. I think remote learning as a parent can be improved a lot. I think we may have a ways to go, but it does prepare our youth for a very virtual future. So we have our kids, we're giving our kids the tools to navigate the digital world in ways we've never seen before. And I think that it can be very beneficial for, your future in the workforce, especially. It can hurt our youth socially in some ways, but I'm learning that, that our kids are very creative with keeping in touch with their peers through different social media platforms. So, there's pros and cons to remote learning, but I'm hopeful. And of course, I'm very hopeful that we'll all get back to school in person really soon.
Great, that's fantastic. So I know hi, my name is Dev. I know the HEP advocates for healthcare coverage for every American. Does that also include undocumented citizens?
Of course. One of our main objectives is to create safe spaces for undocumented families. We advocate for immigrant healthcare rights just as much as we do for anyone else. We can tailor our resources and educational initiatives to best apply to undocumented families and their needs without the need for citizen validation or general paperwork. We believe that everyone deserves the right to, free, accessible healthcare. So absolutely.
My name is Russell, and can you tell us what a pandemic is?
So a pandemic, simply put, is just the global spread of an infectious disease. It affects large areas in mostly all continents. So, there's a difference between an epidemic and a pandemic. And I believe that the biggest difference is that an epidemic is sort of short-lived and it's very acute, meaning it may be just in the local area, and a pandemic is very widely spread. And that's why you see on the news that all countries have been affected. Everyone around the world has been affected. And that's what makes the biggest difference between an epidemic and a pandemic, and why it's so scary and really important to know the difference between the two.
Yeah, no, that sounds scary. It's Lev again. I'm just wondering, can you tell us, to elaborate what COVID-19 really means for us young people?
So COVID-19, basically, it's extremely contagious. It spreads through respiratory particles, through coughing, sneezing, through the air. That's why it's very important to wash your hands, to wear a mask so that you're not easily spreading this disease to anyone else. And what it means for young people is just that, I think that young people can tend to think that it doesn't affect you because we see a lot in the media that seniors are heavily affected, people who have vulnerable immune systems are heavily affected. But the part that teenagers and children play in this pandemic is really important because although you may not have any health risk or you may not be affected directly by the disease, you can still pass it on to someone else who can be affected. Like, for example, God forbid, your grandparents or anyone in your family that suffers maybe from asthma, or heart disease, or just any major health risk. You have to be careful with your hygiene practices because you don't want to pass it on to them. So that's where teenagers play a really big role in this. Because again, a lot of times teenagers don't think it affects them in any way, but it can affect someone you love. So it's just important that across the board we all stay safe.
Thank you for defining a pandemic in COVID-19. Since teenagers are especially important to playing a role in stopping the spread of COVID-19, how can we as young people stay educated about COVID-19, the pandemic, and the vaccines?
So I think the best way to stay educated, to me, is social media plays a really heavy part in keeping us all informed. And I know it's very easy to pull up an article on Facebook and believe everything you read. I think what's most important is to follow your local news sources. There are many news channels available to us where we can be up to date with what's going on with the pandemic. I know that our governor is still giving press conferences. It's very important to, chime into that once in a while. But my favorite source of new news has to be newsletters. So I sign up to like every political newsletter possible. So if you can sort of research your local assembly members, your councilmen, your congressional leaders, they all have links where you can sign up for their newspapers, their newsletters, and they send you email blasts almost daily with very up-to-date information on the pandemic and just up-to-date information on your neighborhood in general. So to me, I think that's the best way, since we're all pretty much on our computers all day, whether it's school, work, and so we're always communicating via email. I think that when you get those email blasts every day in your inbox, it sort of keeps everything relevant when it comes to the pandemic, and it's very easy to follow and easy to understand.
That's very interesting. Hi, my name is Steve, and my question is, when do you think it's the right time to get vaccinated during the pandemic?
So right now right now the vaccines are being distributed in sections. I believe the senior population and people who are very high risk were like the first batch, like they were receiving the first doses of the vaccine. So for you all, like for teenagers and children, I wouldn't expect to get the vaccine until probably late summer. I know right now we're still in like the testing phases of testing the vaccine on children, and I believe that I'm positive that it'll be available for you all before the next school year, next fall. So that's what I would look forward to, is for when you all can take them. And it should be available sometime late summer, early fall. That's what they're predicting for now.
Okay, thank you for keeping us updated. It's Grace again. Can you explain the effects of the vaccine and how it can help fight against the virus and spreading it?
Sure. So the vaccine is distributed in 2 doses. It takes 2 separate visits. So you go in one day for the first dose, and I believe about 2-3 weeks later you can go in for a second dose. Okay, it's distributed in your upper arm by injection. The vaccine helps produce what they call spike proteins that help fight off the virus. It further produces antibodies in your immune system to fight the virus. Some people have experienced mild fevers after the injection, but it usually only lasts about 24 to 48 hours, and in most cases, people don't experience any side effects at all.
That was a good answer. My name is Salakina, and my question is: are there any hygienic practices that we should do more or start doing during this time?
So I think that it's still important to know that COVID is still here. We haven't beat this yet. And even though some of our numbers may be going down, I think it's still really important that we all avoid social gatherings as much as possible until most vaccinations have been distributed. We can also achieve this by continuing to wash our hands frequently and wearing a mask in public. Masks are pretty much mandatory in every state, but it's still it still takes some daily reminders to walk out with a mask. I know I sometimes forget and I have to go out and buy one, but wearing a mask is really the most critical thing you can do during this time. So that's, encourage your friends to wear masks and just be an example for your friends too.
So next to encouraging others to wear masks, what other things can we encourage people to do during this pandemic?
Again, so I think it's just really important to set an example for your friends. Just to be that example. Avoid social gatherings. Wear your mask. Wash your hands, and just it's simply just speaking about it with your peers too. Just reminding them and just telling them how important it is to stay safe because they don't want to harm the people they live with or even harm themselves. So yeah, that's pretty much what what you can do is just to be a prime example and practice all of these safe practices yourself. Social distancing, washing your hands, wearing a mask every day.
Thank you. When it comes to the topic of vaccinations, it's like a really sacred topic with other people. Like most people have the fears about getting it because they think they'll contract the disease. But what are some ways or some advice you can give to the viewers to ensure them that the vaccine is safe and it's very easy?
So I think that the best way for us to feel safe and secure taking this vaccine is, in my opinion, is just to speak to those who have already taken it. Now, maybe you all haven't, you all don't know, amongst your friend group, people who have been able to take the vaccine yet. But I have been tasked the past few weeks with doing in-person interviews with some people that I know personally who have taken the vaccine. And I think that the one thing that I gotten away from interviewing these people who did take the vaccine is that although taking a vaccine may be scary, some people are worried about contracting the disease after being injected. What's scarier than having a vaccine is having COVID. And if you had to outweigh the risk and benefits, it's best to just stay safe and protect yourself and protect others. The vaccine, for most people that I've interviewed, they didn't experience any side effects. And some of the people who did experience side effects was very minimal. So, I would say it's going to take a lot to gain the trust of the community, but with speaking to people, engaging in conversation with those who have taken the vaccine, we'll all learn to feel more comfortable, especially when you're listening to someone that you trust who has taken the vaccine. Then you can feel more secure with taking it yourself too.
Thank you for your information and advice, Jocelyn. Those were all in line answers. We hope to talk to you again soon. And thank you all for tuning in. Stay safe, and we'll see you again next time on Open to All. Bye.
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 Thank you guys so much. So nice meeting you all.
Nice meeting you.
Yeah, nice meeting you.
Nice meeting you
Nice
too.
to meet you.
Bye.
Thank you.